Now, second speaker is Professor Bedros Yavru from Armenia. He is a French doctor in American doctoral degree from New York University, and he is a professor at New York University College of Dentistry. Topic of lecture is children oro-facial muscular dysfunction. Bedros, please.
You need to open your microphone first. Professor Bedros, you need to open the microphone. Once again.
Okay.
Okay, now it's all right. You can start the presentation.
Okay, you are presenting. I click on. You are
No,
presenting.
you return back to the PowerPoint.
To PowerPoint, yes.
Click it. Now you can start presenting.
Is it showing?
Yes, we can see it.
I see. Okay. First, I would like to thank Professor Marian Constantinescu and also Professor Florin Constantinescu for their kind invitation to the INNOBIODENT 3.0 conference as a lecturer and also as a moderator for today's session. I must say that their dedication and commitment to our profession is exemplary. Without further delay, I would like to talk about my presentation, which is children's oro-facial muscular dysfunctions and the importance of their preventive treatment. The development of children's breathing is directly dependent from their oro-facial muscular activity. The activity of these muscles is essential for the normal development and growth of craniofacial bone structures, the normal eruption and positioning of the teeth, the normal development of vital functions such as chewing, swallowing, speech, and more importantly, breathing. Among the oral muscles, the tongue, by its size, position, frenulum insertion, and its powerful activity, has a very important role in the normal development and shaping of skeletal bony structures of the growing children's maxilla and the mandible, including the size, the shape, and the volume of the palate and the floor of the nasal cavity. Consequently, the tongue controls the anatomic development of oral cavity, the patency of the retropharyngeal region, and the volume of the breathing spaces. Breathing is humans' most important and vital function. As all we know, without breathing, there is no life. Without diagnosis and treatment, these breathing dysfunctions can silently and slowly destroy child's health, well-being, and quality of life. Very often, during child's initial medical or oral examination, parents, including health providers, do not pay attention and they simply overlook or ignore the diagnosis of these dangerous breathing dysfunctions, such as open mouth breathing. Normal breathing should be from the nose and not from the mouth. The nose is for breathing and the mouth is for eating. During breathing, lips should be closed without perioral muscular activity. Among the multiple types of breathing dysfunctions, children's open mouth breathing is a very dangerous one. If not diagnosed and treated as early as possible, the consequences of a long-term open mouth breathing can be very dangerous and destructive for the children's oral, general, and psychological health. I would like to show a short video of an 8-year-old child whose open mouth breathing was complicated into an obstructive sleep apnea. As you can see, the child is breathing with an open mouth during the sleep and has difficulties to breathe. And instead of resting during the sleep, child is going through a torture. And of course, this is a really very difficult situation. It's very, very difficult. I will go a little faster. As you see, the consequence, the next day in school, in the classroom, how is it possible for this child to concentrate, to understand, to learn, and to be successful in school? He will fall asleep. One of the most important human organs which is sensitive to breathing dysfunction is the developing brain of the child. In fact, the normal breathing and oxygenation are very important for the proper brain development and the mental capacity of a growing child. In obstetrics and gynecology, there are many documented cases of children who suffer from brain damage caused by a prolonged anoxia during childbirth. On this subject, Professor Karen Bonjour at the Albert Einstein University of New York has clearly demonstrated that respiratory dysfunctions during the day or at night during the sleep can damage the cerebral neurons and can impair the brain's development and normal functioning of the brain. Another study by Professor Karen Bonjour in 2012 demonstrated that oral breathing in children is the reason for an insufficient air intake and insufficient oxygenation of the patient tissues, in particular of the brain tissue, which can be the cause of child's behavioral problems. In 2022, our research study at the New York University College of Dentistry proved that the IQ, the intelligence quotient of children with normal breathing, is much higher than the intelligence quotient of children with mouth breathing. During mouth breathing, the oxygenation and maturation of child's brain cells is not adequate. Therefore, the brain will not function at full capacity. Consequently, the child will not be able to concentrate, understand, memorize, and learn properly. This can be the cause of child's learning deficiency and the reason of school failures. And if not corrected timely, later on, it can be also the reason for failures in life. Child's school failures can also cause psychological problems, such as a low self-esteem, an inferiority complex, a nervous depression which could complicate into obesity or bulimia, or an antisocial violent behavior such as an extreme anger, hatred, which can go as far as murdering people, or addiction to drugs, to narcotics, which in turn can go as far as committing suicide. Other dangerous consequences of mouth breathing, just to give you an idea, each one of these can be the subject of a separate lecture. First, of course, increased stress and constant fatigue, sleep disturbance with snoring and obstructive apnea, decreased mental abilities, difficulty of concentration, memory loss, Alzheimer's disease, cardiovascular problems, high blood pressure, heart attacks, impairment of the nervous system, slowing down of nervous activity, depression, immune system deficiency with decreased resistance to infections, problems with hormonal system, disturbed hormonal balance, disruption of the digestive system, indigestion, constipation, bulimia or obesity, disruption of muscle function, slowing down of muscle activity, feeling of fatigue, hearing problems, decreasing hearing, tinnitus, internal ear infections, body balance and posture problems, typical forward tilt of the head and torso to breathe a little bit more comfortably. Finally, as I already mentioned, serious psychological problems with conflicts and problems in relationships at home and at work. The treatment of choice of these breathing dysfunctions is the myofunctional treatment. Myofunctional treatment by opening child's obstructed airway will favor the normal breathing as well as the normal oxygenation and the normal maturation of brain cells, which in turn will improve mental activity, alertness, attention, concentration, learning, and memorization. Consequently, myofunctional treatment will increase child's self-confidence and success in life. I do not want to go into detailed explanations of myofunctional treatments. These myofunctional treatments can be done with intraoral appliances, which can be prefabricated or custom-made. Also, they can be removable or fixed to the teeth. Their principle of action is always the same. They open the bite and push the mandible forward, which in turn opens the airway and normalizes patient's breathing. In addition, specific muscle reconditioning exercises should be performed regularly. Some example of patients treated with myofunctional treatment. Here we can see clearly that after myofunctional treatment, child's mandible is in a forward position. Consequently, at the retropharyngeal region, child's airway is cleared and opened. Therefore, child's nasal breathing is well established. Also here, we can see the result obtained in our adult patient with myofunctional treatment. Again, the mandible is at the forward position and the airspace at the retropharyngeal region is cleared. On this photo taken before and after myofunctional treatment, on the left side, you can see that the child is like a sleeping position. Look at the eyes, no concentration, and the mouth is open. After myofunctional treatment, you can see that the eyes are open, concentration is 100%, and the mouth and the lips are closed. And this result has been obtained in almost a year and a half treatment. Here, we can see how the teeth can be perfectly aligned after a well-coordinated myofunctional and orthodontic treatment. The maxillary crossbite on the left side has been reduced by opening the bite and with palatal expansion, and the teeth have been placed in a normal and aesthetic position. And the aesthetic of the face is established, and the result is satisfactory. Here we can see the improvement of child's facial aesthetics. Extreme mandibular retrognathia on the left side has been treated and the lower part of the face in the normal position. The mouth is closed and the lips are in contact. Also, looking at his eyes, we see a clear improvement of his concentration. Here on the left, we can see clearly the resorption of the condyle head and after almost a year and a half of myofunctional treatment, the head of condyle and gland at the glenoid fossa have regained their normal anatomical shape. In addition, the painful symptoms, including the tinnitus at the temporomandibular joint, have disappeared. I would like to show you a very common problem, which is the ankylosing. It can be a problem for the breathing of a child. Ankylosing in children and adults is one of the main reasons of oral neuromuscular dysfunctions. As you can see, the ankylosing of this newborn child, if the frenectomy is not performed as early as possible at birth, the ankylosing can have bad consequences on the baby's normal maxillomandibular bone growth and child's vital functions of chewing, swallowing, speech, and more importantly, breathing. After frenectomy, the dorsum of the tongue is released and it will shape normally the oral and facial skeletal bony structures of maxilla, the vault of maxilla, and the mandible. In addition, ankylosing can cause the failure of child's nervous system, called ADHD, the Attention Deficit Hyperactivity Disorder, which is due to a difference between brain development and hyperactivity. ADHD affects child's posture, attention, and self-control. In fact, a simple frenectomy at birth prevents such multiple dangerous consequences. In conclusion, normal nasal breathing is important for child's normal growth and well-being. Early diagnosis and preventive treatment of breathing dysfunctions is a must. Myofunctional treatment is efficient in the treatment of neuromuscular dysfunctions and can be done at the same time with other orthodontic treatments such as aligners or orthodontic with brackets. However, parents have an important duty and role in diagnosing the open mouth breathing of their child and in supervising child using the appliance and performing the muscular exercises at home. Also, myofunctional therapist has an important duty and role to gain child's confidence. Much more importantly, the success of myofunctional treatment depends from child's cooperation and admission of these treatments. However, myofunctional treatment is not an overnight solution. Myofunctional treatment needs time, patience, commitment, determination, and dedication from parents, the provider, and more importantly, the child. Finally, a view from Yerevan, the historic capital city of Armenia. I hope to see you all there for another Congress, or simply to enjoy the beauty and the hospitality of Armenia. Thanks all for your attention.
Thank you, Professor Bedros Yavru-Sakuk, for your very important lecture. Thank you so much.
Thank you, Professor Constantinescu.